Welcome to Community Watch, and today we'll be talking to the Director of Northwest Georgia Public Health, Dr. Gary Voccio, and we'll be talking about testing and other COVID-19 related materials. So Community Watch starts right now.
Welcome to Community Watch. Greg, how are you doing?
Fine, brother, and yourself?
I'm all right. Yeah, I'm all right. I'm really glad that we were able to get the guests that we have today to talk about a lot of things that are going on with the pandemic in Northwest Georgia. So let's talk to our guest, Dr. Gary Voccio. Welcome to the show.
Thank you.
And you are the Health Director for the Georgia Department of Public Health Northwest District.
Correct.
Right?
Yes.
That is quite a title. That's a big business card you must have. But I believe you retired as pulmonologist?
I was a pulmonology critical care doctor at Harbin Clinic. I practiced at the Harbin Clinic almost 30 years, and our hospital affiliation was at Floyd and Redmond, where we practice. And my partners practice together.
Well, your particular expertise in the current times, I think, is invaluable. If you could just kind of give us an idea of, and I know we want to talk about testing and some other things, but if you could give us kind of a sense of whether or not you think we've made any progress here or we're moving too quickly. Do you have a sense of that locally if we're opening up too much too soon?
No, Dr. Hershey, I don't think we are. The governor decided not to go through the 14-day gating process. He really wanted to open up the economy, and I agree with that. I talk to my former partners frequently. I talk to the medical community. I have a lot of still friends and ex-partners who are practicing, and we're not seeing an extreme number like we saw earlier in this pandemic. Seems to have stabilized, at least in this part of the state. People are still worried about it, and I am too, but the numbers are certainly going down. We are still flattening. We still see a flattening of the curve. They are certainly declining in total numbers. The case rate for this part of the state is still very stable and not exceptionally high, at least in Floyd County and the other surrounding counties. Bartow is a little different. They had that early, the super spreader event there. So their numbers are always going to be higher, it looks like. But they aren't seeing the extreme numbers that we saw earlier in this pandemic, say in March. So the numbers are really trending downward, and the models, no matter what models you look at, the CDC modeling devices that they use certainly do show flattening of the curve, depending on which model you want to look at. They're all showing that. And we're seeing that too here in Georgia, in Northwest Georgia, in our 10-county area.
So, Dr. Voccio, I hate him probably butchering your name,
No,
but in saying that, is that because of the shelter-in measures we had in place that we see a stabilization of the numbers and they're tending down?
I think so. I really do. I don't go out much, but when my wife goes to the grocery store, et cetera, or I've been to Home Depot once or twice to get things I really needed, people are wearing masks. They are doing 6 foot, distancing. I've seen that. My wife has seen it at the grocery stores when she's had to go. We're wearing masks and we're cleaning our hands, but I think the people in Northwest Georgia, for the most part, really took this very seriously. Particularly when we saw the earlier super spreader event in Bartow County, and one of the first cases in Georgia was here at Floyd Medical Center. So people really took it seriously, and you have to commend our medical community. We have two very, very good hospitals here in Northwest Georgia, and very good physicians practicing there. And they realized what we were in. They realized what we were in for. Both hospital administrations, and I know them well, and I know their chief medical officers well. They took it very seriously, and the community did too. And with the help of the media, and the physicians, and the nurses, and the respiratory therapists, and all of the medical personnel that are caring for these patients, they did the right thing early on, and it really shows now in our numbers. Granted, no one foresaw the super spreader event in Bartow County, but those physicians there, and I know some of them also, and I've met with them, they took it seriously too. So I really think early on, when we realized what we had, and the medical community and the community at large saw what was happening, I really think we really slowed it down. And it really shows on those numbers now. That's not to say that we're going to see some spikes, and I think we will. But I think the medical community and the community at large is prepared for it. We know what to do. We know what to expect. So I really have to commend Northwest Georgia for what we've done.
I'm wondering, since the gradual reopening here in Floyd County and throughout Georgia is just over a week now, if we really have had enough time to know if it's going to have an impact on the numbers of individuals who are ill, or if we need to wait a little while to really know.
You're right. It's too early to tell. We are broadening our testing capabilities in Northwest Georgia. We initially did not have enough testing kits, but we now have ample testing kits. We are opening up our specimen collection sites. We went from 2 to 4. Now we have 8. And we are doing more testing every day. But we're always looking in the mirror at our test results. And the reason is, as we've done more tests, it's slowed the results coming back because the labs are overwhelmed with what we're doing. We have done more than we've ever done in testing. We went from 40 tests a day in Northwest Georgia because of limitations of tests. Now we're doing over 200, which is a smaller number, but in Northwest Georgia, we are doing just as good as anywhere in the state in our testing, except for the major metro areas, as you would expect, where there are more people. But we are doing more than ever, and we are broadening our testing capabilities and expanding our sites. But we are looking in the rearview mirror. We are getting our test results back slower, unfortunately. The governor knows this. The commissioner knows this. All of the district health officers are well aware of this. And we're pushing the lab to get the test done. Not the state lab, but the private lab that we were contracted with. And they're all behind. The state lab is doing not as behind, but they're all behind in getting the test results back. And looking in the rearview mirror, you're right. You don't know where you are until the test results come back. And they're behind. So we are going to be looking at 5 to 7 day late data. You're right.
Doctor,
go ahead.
I'm curious because you start talking about testing. I guess that's confusion for me because I hear all of different testing, then the testing requirements. I passed by a urgent care just the other day, and it said COVID-19 free testing, COVID-19 testing here. And I'm curious, what's the qualifications for even getting tested?
The qualifications are very broad. Anyone with any symptoms of cough, shortness of breath, fever. 2/3 of people with COVID-19 have a loss of sense and smell. So if someone calls, or a physician or healthcare provider says, I have a patient here who has some muscle aches, they've lost their sense of taste or smell, they'll be tested at a health department site. They just have to call and get a number. They drive up and get a nasal swab. Also, we've broadened the criteria for even asymptomatic healthcare workers or asymptomatic first responders, firemen, police officers, anyone can get tested who's a first responder or healthcare worker. We've also expanded the testing for any minority without symptoms. We know that minorities have had major impact on their health status. So we've even broadened that, and that came Sunday by the CDC's recommendations. So yesterday we started broadening that scope also. So practically anyone with any sense of respiratory issues, cough, fever, lack of sense or smell, muscle aches, any symptoms possibly related to COVID-19, we are testing.
So as an African American, even with no symptoms, I could still be tested?
Yes, sir.
And so what would I need to do?
You call one of our 4 numbers that we have available. Call the numbers and say, I'm an African American. I would like to be tested at one of your testing sites. You will get a number to put on the windshield of your car. You drive up. That's checked off to confirm. Yeah, we'll test you. You go and get a nasal swab. Takes about a minute, and you drive off.
Yeah, and I'm glad to hear that, because I know the other day, I think in the paper, Mr. Boggs had said, I guess the demand for testing was low, I think is what he was saying in that article. And I was just surprised, because for me, I know I was just confused about the process. What do you have to do to actually get tested? Yeah. And that's one thing I was glad that you was able to come on today, because I don't think I'm the only person that's confused about the process. And then you have different tests. So if you don't mind, what is the test that y'all do, I guess, compared to is it the antibody test?
Yeah, that's a very good question. We're doing what's called a nasal swab, a nasal pharyngeal swab, which is it looks like a Q-tip. It's got a long plastic stick, and it's goes into your nostril, either into the front part of your nostril, depending on the test kit we have that day. There it goes a little deeper into what's called the pharynx, or the back part of your throat. It's twirled slightly, it's put into a little plastic vial, and it is sent to the lab. That's called a polymerase chain reaction. It's looking for viral genetic particles, okay? Viral genetic particles. It's pretty sensitive and specific for that testing. The antibody testing is just a prevalence test to see if you've had at one point in the past a possible COVID-19 infection. It doesn't mean you're infectious at that time. It doesn't really tell you exactly when you were sick. It just means at some point in the past, possibly within the past few weeks or longer, you have had an infection with the COVID-19. The FDA and the CDC does not approve of that. We were using that as a positive test at one point. The state was utilizing those numbers as a positive test, but we are not doing that anymore and stopped doing it 2 weeks ago. The reason is there were about 3 or 4 dozen different labs doing antibody testing. None of them were validated by the FDA. None of them. They're not approved by the FDA. And the reason was, under an emergency use authorization, or EUA, the federal government allows labs to set up their own lab testing, and the FDA says, okay, you have validated it yourself, we'll just check you off as a valid test. They're all over the place, all over the place. you can be, we've had these tests come to our office that I reviewed. Patients have been tested positive one time. For some reason, they've gone back to get another test. They were negative another time. So the tests weren't very valid. So we are not using them right now. Now, for your viewers and for you to know, the CDC has been doing some community-based testing in the Atlanta area, and that's called seroprevalence. They are trying to target a community population that is done to see if statistically this subset of people could have had COVID-19. And they can use that demographically in other populations. So the CDC is using their validated test for that. But as far as drive-in clinics doing it, they are not validated by the FDA. So we are not using those numbers anymore.
All right,
so one is a viral particle for your nose, and the other is a blood test for antibodies.
We need to take a quick break here, but we will be right back with a lot more discussion, so don't go away. We'll be back after this.
Your life is filled with opportunities to show the world you can take charge. It's waking up each day with a mission. It's working each day toward a goal. It's choosing to rise. It's charging forward with a purpose. It's changing the course of your life and taking charge of your future. If you're ready to be a Take Charger, enroll at Georgia Highlands College today.
Welcome back to Community Watch, and we are in the middle of a conversation with Dr. Gary Voccio, who is the Health Director for the Georgia Department of Public Health Northwest District. And we've been talking about the tests that are and are not available. There have been problems, I understand, with the antibody tests. So the tests that are currently available, if I'm correct, are for individuals who are currently experiencing symptoms or who are in a risk group. Is that correct?
That's correct.
And I know early on there was some concern about whether or not the tests were good tests. We not locally necessarily, but we were reading a lot about these tests also being, having the potential to be inaccurate. Is that worry no longer there?
We have had no indication that we're having a lot of false negative or false positive results. Initially, what happened was the CDC sent test kits out to the public health departments nationwide, and there was an error in those, and they had to be recalled. But that was very early in this pandemic. So we seem to be having good results, accurate results with our current lab tests.
And Greg, I think, may have already left to get his test. But for individuals who may not be in a risk group but have symptoms, are they able to call directly, or do they need a physician to indicate to your office?
No, they can call directly.
They can.
They can call directly, yes.
And those test results now are coming back in about, did you say about 7 days, about a week?
Anywhere from 5 to 7 days, unfortunately. But the commissioner knows it, the governor realizes it, he's been informed. We are trying to get that improved. What we were told late last week is that the current labs that we are using, and there's a couple of them, but they're all behind, unfortunately. The lab we are using in Northwest Georgia at the recommendation of the commissioner's COVID-19 pandemic group, we are using a lab called Ipsum Labs, IPSUM, and that was recommended to us. And we changed from one lab to Ipsum at the request of the commissioner. They are behind, but we were told that they hired many more employees. They're doing 24-hour a day, 7-day a week lab testing on the tests we send to them. So hopefully we'll get an improvement in that. But that was the end of last week.
And let me ask too, with that delay in getting results, if an individual does have symptoms, I mean, that's 5 to 7 days of potential spreading.
Well, that's a good point. If somebody has any symptoms, we advise them when they want to get tested, they should stay in isolation until they get their test results back. Regardless of the test results, if they have symptoms, they should be in isolation. That's the smart thing to do.
Dr. Voccio, before we went on break, we was talking about the drive-up test. And I got 2 questions for you. What happens if the test comes back positive, and how are people notified if they're positive or negative?
The epidemiology staff here in our office, we have 7 epidemiologists working. They're working 7 days a week, Greg. What happens is if you get a positive test results back, and if you are symptomatic, you should stay in isolation. Do not make any new contacts. You know, you don't want to spread this if you think you are symptomatic with COVID-19. You get the test results back. If they are positive, our epidemiologist's office will call them and give them the results, negative or positive. They will get the results by phone from one of our epidemiologists. And at which time, you know, if they have had symptoms, then they should stay in isolation for 10 days. It used to be 7 days. The CDC changed it yesterday to 10 days.
And that is leading me to another question. So if comeback's positive, even if you're not necessarily, you may be asymptomatic, if it comes back positive, it means you are still infectious.
And you stay on isolation for 10 days from that first positive test. So you're on isolation for 10 days, regardless of your symptoms. And they think that at 10 days, it was 7 days initially. They changed it yesterday. Now it's 10 days because they realize that people, what they call viral shedding, still occurs at 10 days. They're now certain that it is a little longer than it was in the past. Some people will have viral shedding longer than that, but they are not sure if those are dead viruses and they're just testing the viral particles or they're live viruses, but they are now extending it to 10 days in isolation.
And I'm gonna let you get in here, Doc, but one last thing. From what I heard this morning, now they're including headaches as part of potential symptoms.
Yes, headaches, and there a small number of people have nausea, some people have diarrhea. We are testing practically anybody with most symptoms. If they call, we're testing them.
And do we know yet whether or not having had the illness means you will not get the illness again?
That is an excellent question. There is still no data on that. That's why the CDC is doing the seroprevalence testing in the Atlanta area. They are testing this to track these people if they are positive and for antibodies. And we do not know that. We do not know if it's going to be, you're going to have immunity to it. We do not know if you have a large amount of antibodies, you will be immune. They do not know any of that yet. They do not know if you're going to still remain infectious or not with positive antibodies. They do not know that data. That's why they're doing it.
Doc, I'm curious. We know now that Georgia has, everybody's back out and moving about. I just read this morning that they have closed in Florida, in Miami Beach, South Point, Pier Beach. They closed it after 5 days because they said literally thousands of people were there without masks and social distancing. So even though we know our numbers have stabilized and are going down, or we've flattened the curve, should we all still be wearing masks?
Yes, you still should be wearing masks out in public. You still should maintain 6 foot distancing. Absolutely continue washing your hands. Be careful of touching any surfaces. The virus can live on surfaces for a long period of time, depending on the type of surface. I strongly recommend mask wearing. If you have gloves, if you can find them, gloves, absolutely if you go out in public. We are still not in a safe space. There's no such thing as a safe space in this pandemic. You can pick up the virus anywhere, at any time where someone may have had the disease and you have had an exposure. Please wear masks, gloves if you have them, and maintain 6-foot distancing.
Well, let me ask this, because you mentioned, if you can get gloves. I'm assuming that there may be a lot of folks who don't have access to masks or gloves. Is that something that they can kind of make for themselves? I mean, will a scarf work as well, or?
Well, it's better than nothing, yes. The CDC does recognize that there's a shortage, and yes, it's better than nothing. Cloth is permeable to some viral particles. There are, you've seen the CDC website of manufacturing your own. Yes, some is better than none. Yes, I strongly recommend a cloth mask if you cannot purchase or find surgical mask, absolutely. And in the absence of gloves, wash your hands frequently. Try not to touch any surfaces, doorknobs, elevator buttons, all those things that people touch. I strongly recommend to try to avoid, if possible, touching those surfaces if you can.
I know that your service area is quite large. 10 counties, is that right?
Correct.
Are all of these counties providing similar services, or are you advising them to come to the Floyd County area, or?
Oh no, we have opened up our specimen collection sites. At first, we had it in Bartow and Floyd County because of limited testing capabilities, but 3 weeks ago we opened up in Paulding County and Walker County, so we had 4 testing sites, including the Bartow and Floyd. So we went from 2 to 4. Now we have also what we call pop-up sites in Catoosa, Dade, Chattooga, and Walker County on a scheduled basis. And we started that yesterday. And we're going to continue those until we see either we can change that or expand it if needed. But we've gone from 2 to 4 now to 8. So we expanded that.
And do you anticipate that we will need to be careful in this way for quite a while?
Yes, I do. I'm not a prognosticator in this, but yes, it's going to be quite a while. There's some prediction models that are predicting 18 to 24 months. There are other prediction models that think it's going to be shorter, maybe late summer, fall. I cannot predict, but it's going to be a long time, and a long time anywhere from 6 months to 24 months. And those are just prediction models that I've read.
Well, we only have a short time left, but we appreciate so much your being with us today and talking with us. And Greg, I think we may need to have the doctor back again.
I'll be glad to.
So we'll be in touch, and thank you, and thank all of you for being with us this time on Community Watch.